السلام عليكم دكتور دعاء.
أهلا وعليكم السلام.
رحب فيكم حضورنا الكريم في مخيم الجراحة السعودي في آخر فقرات اليوم الأول لمخيم الجراحة السعودي، واللي بنتطرق فيه لموضوع الفيميل جنرال سيرجري ريزيدنت مع الدكتورة دعاء الفالح، Consultant General and Endocrine Surgeon, former Director of Residency Training Program, Deputy Team Leader of the Accreditation of the Preoperative Team. أهلا وسهلا دكتورة دعاء.
أهلا فيك. طيب بس دقايق just to share my screen.
ولا يهمك دكتورة.
First of all, I would like to thank you all for the invitation. سامعيني؟ الصوت واضح؟
أيوة دكتورة واضح.
طيب تمام. So in my speech, I'm going to talk mainly about the female surgeons in general. So I will just give you كده some hints يعني about my history as a surgeon. I actually decided to get into the field of general surgery or in the field of surgery since I was in fourth year medical school when we first were exposed to the clinical subjects like general surgery, medicine, and all the clinical subjects. So at that time, I was really excited with the subject of general surgery, as you know, you all know, because of the adrenaline rush, all the fine works, the quick results and outcome for patients. And this is where I decided to be a surgeon. Actually, when we went through the medical college, until the sixth year, it was still a dream that I wanted to come true. And I got attached to many of the big names of general surgery, like Prof. Merdad, Prof. Talal Bakhsh. And this is where I was really attached to this dream to become a surgeon. After I finished my medical school, actually, when I took the opinion of my professors whether to encounter surgery as a field or not, they all had the same answer. Why general surgery? No, you're a female, you shouldn't go through this. And no, do not go through this. You go and look for other specialties. My parents were also against this idea, why to become a general surgeon. My father wanted me to be a radiologist, and my mother wanted me to be a gastroenterologist or ophthalmologist, but still the dream of being a surgeon was always there. So actually, I went through the Saudi Commission, the test to go through the surgical program and also for medicine, and I got accepted in both. But I kept attached to my dream, which is to become a surgeon. And I went and I got attached and accepted in the general surgery program. So I'm going to talk in general about about highlights in women being a surgeons. So unfortunately, and not only in our country, in most of the countries, women remain underrepresented represented in the surgical careers. Actually, there are there are various obstacles, and we're going to talk about the obstacles in general surgery or being a female in the field of surgery during our career. Difficulties usually it's how to actually how to associate between professional and social parameters. So this is usually the challenge for us as females in the field of surgery. So as we can see, the number of general surgeon or surgeons in various specialties in around the world is low. So women, for example, in England and Ireland, the percentage of female surgeons is only 13.2 and 7% of all the surgeons. In Japan, actually, it's only 6.9% of the whole Japanese society. And the US also, it's only 25% of all the whole society. So why? What are the reasons, or what are the obstacles for females to be a surgeon? So unfortunately, gender discrimination plays roles. So still, there are some people who don't believe or think that females should not go into the field of surgery. Um, sometimes, sometimes they don't. Females, most of the countries, they don't take leadership, but this has changed right now, and we'll talk about this later on. Work-life imbalance, and I think this is the most important one. The field of surgery requires rigorous training. Some of the procedures have lengthy, yeah, they take very long time. The on-call responsibility, and for us as females to accommodate between our social life, for example, like being a wife and a mother, and also a surgeon, is a challenge for us. The physical demands and sometimes the pregnancy difficulties. There are multiple studies that talk about the increase in the infertility in the field of surgery, for female surgeons, I mean. And sometimes because of the stressful and lifestyle of for us as surgeons, some of the studies showed that there's an increase in the proportion of abortion, preterm delivery, and congenital anomalies among female. But the percentage is higher for female surgeons. Maternity leave, and this is something that actually we face in the Saudi program, that we don't have maternity leave for females. It's only their annual leave plus they can freeze few months of their program. Sometimes they face specific challenges, like for example, in the field of anorectal procedures, some of the males refuse to be examined by female surgeons, also in the field of urology. So this is one of the causes of embarrassment for females, between males and female surgeons and the male patients. In some of the countries, there are some reported that there's a pay gap between between genders, between females and males. Alhamdulillah, in our country, we don't have that. Like, let's think positive. Like, so there are some studies actually that proved, there are some studies that was published in JAMA Surgery in August 30 and 23. It's a retrospective cohort study that was performed in Ontario, Canada, that compared the outcome for the outcome of the post-operative outcome for among female patient surgeons in elective and emergent surgeries, and they found that the patients treated by female surgeons have significantly lower for long-term, between 90 days and 1 year, rate of adverse surgical outcome. So is there any kind of change in this? Yes, there are some changes. So women are are starting to take some leadership positions, especially in our countries. I know that some of the female surgeons are becoming the chairmen and the head of some of the surgical departments, and the population awareness also have changed. Now the people are becoming more accepting the female surgeons, and the female doctors are also started to prove themselves in many surgical fields. This is a picture for me and residents from different hospital at our respected center. So you can see the number of females in the picture compared to the males. And they're all excellent, mashallah, and they did a very, very good job. This is one of the procedures that we did, and you can see the whole team is only females. This is another picture where we did a total thyroidectomy, and you can see that my resident sent me a picture for a team for the operation where all the team was only females. This is me operating with one of the a great hepatobiliary surgeon at our institute, Dr. Abrar Nawawi. She's an excellent surgeon, and also the team was actually between females and males. So for females, if you ask me if I go back to time and to choose between being a surgeon and not being a surgeon, I would definitely tell you that I would still choose surgery as a female, with all the challenges and all the obstacles that faced us. Thank you.
الله يديك الصحة والعافية إن شاء الله. Very interesting study, دكتورة دعاء, you presented. Where was it published?
The study actually was published in JAMA journal. Surgery. The study was published in August 2023.
Okay, just a year ago.
Yeah, exactly.
And why the outcome was like better, or the adverse outcome better compared male to female?
Actually, they didn't mention any name, but one of the reasons that they said in the study that some of the females had to take a part-time job. And also the empathy that the patients took from the females was more.
Okay, interesting. Allah يديك الصحة والعافية إن شاء الله. And I think it's a great conclusion for يعني our day of lectures. We appreciate, for those who don't know, Dr. Doaa Falih, one of the pioneers in the surgery program. She led the university program for the past 4 or 5 years. She did extremely well in this perspective during her programship period. The program يعني was one of the pioneers, and recently more than 25 of the residents who scored the highest mark in the exam were from her center. We really appreciate you coming, and we appreciate your effort with the resident everywhere. Allah يديك الصحة والعافية إن شاء الله دكتور دعاء.
Thank you so much, Dr. Bassem, and thank you for the invitation.
المايك معك خالد.
شكرا لك دكتورة دعاء، سعيدين جدا بحضورك المميز معنا دكتورة، الله يعطيك العافية.
الله يعافيك.
إلى هنا نوصل لنهاية اليوم الأول في مخيم الجراحة السعودي المعد من النادي الطلابي الطبي. شكرا جميعا لحضوركم، ونراكم على خير غدا في اليوم الثاني لمخيم الجراحة السعودي. محدثكم خالد الروقي، في أمان الله.